This presentation provides a general overview of CARF's Digitally Enabled Site Survey Program, referred to as DES. Thank you. We commend and thank our accredited programs for their courageous work in doing the very best to ensure continued quality services to the persons served and their communities during the COVID-19 pandemic. Organizations that commit to accreditation and implement the CARF standards are well positioned during difficult conditions to support and protect their stakeholders and enhance the lives of persons served. The safety and well-being of persons served, staff of accredited programs and services, and our surveyors are CARF's foremost priority. The future course and effects of the COVID-19 pandemic are unknown, and it's uncertain when in-person interactions such as on-site surveys can resume safely. CARF recognizes that organizations are challenged in the current environment to continue delivery of quality health and human services while remaining solvent and maintaining compliance with legal, regulatory, and contractual obligations. For these reasons, CARF has developed the Digitally Enabled Site Survey Program, DES. What is a Digitally Enabled Site Survey Program, or DES? It's an accreditation survey process conducted through an online platform that combines audio, video, and file storage. How does DES compare to a traditional on-site survey? The DES survey will mirror a traditional on-site survey as much as possible. The activities of DES surveys will be conducted using technology that include a peer-based consultative process that utilizes the CARF team orientation and exit conferences and pre-exit meeting if requested, a tour of the organization, a review of written documentation including plans, policies, procedures, protocols, reports, data, and other information, a review of records of persons served, confidential interviews with key organizational staff, persons served, and other stakeholders, opportunities for discussion and consultation. Following a May pilot, DES applies to accreditation surveys starting in June 2020. Although CARF intends for this program to be time-limited, it will remain in effect in full or part, at least until environmental conditions allow for safe in-person on-site surveys. Note that DES is not available for some international surveys. Please consult a CARF resource specialist for details. Each survey that participates in DES within its regular survey timeframe will be conducted under the primary standards manual identified in the survey information summary for that timeframe. Each survey that participates in DES outside its regular timeframe will be conducted under the primary standards manual in effect for the timeframe in which the survey occurs. For original surveys, timeframe is based on application submission date. For resurveys, timeframe is based on current accreditation expiration date. An organization unable to have a DES resurvey in its regular timeframe should contact its assigned CARF resource specialist to discuss whether it may be issued a temporary extension of accreditation of up to 6 months. If an extension is issued, the survey must participate in DES within the survey timeframe that corresponds with the extended accreditation expiration date if DES is in effect at that time, or the accreditation will expire. DES survey fee. The survey fee is based on the year of the primary standards manual. A 7% discount for each DES resurvey, review, survey, and supplemental survey. An additional 7% discount for each DES original survey, resurvey, and supplemental survey that participates within its regular survey timeframe. DES survey process. Technology requirements. Reliable high-speed internet service, recommended to have at least 25 megabits per second of internet bandwidth. Devices? At least one desktop or laptop. At least one mobile device, laptop, tablet, or mobile phone with video capabilities. Microsoft Teams application enabled on all devices. About Microsoft Teams. Microsoft Teams is a unified communication and collaboration platform that facilitates the activities of a CARF accreditation site survey, including video conferencing and file storage. Safe end-to-end encryption, and it's free to the organization. Desk survey process technology preparation. After scheduling the survey, the organization's survey key contact and accreditation liaison will receive an email invitation to join MS Teams. Once invited, the organization may request that CARF invite additional organizational staff who may assist with uploading documents. Desk survey process. Technology preparation. The organization should establish an MS Teams account. Sign in, become familiar with, and test MS Teams. Team channels and meetings functionalities will be used. Review recommended MS Team trainings. Contact CARF for support using MS Teams. Pre-survey contact. About 20 days prior to the survey team coordinator will meet with the organization via MS Teams to go over customary pre-survey preparations, as well as to confirm the organization has sufficient familiarity with MS Teams to conduct the survey. Confirm how technology will be used for each survey activity. Determine if additional organizational staff should be added to MS Teams to upload documents. Determine survey room needs. Determine if Google Duo or FaceTime may be used to supplement MS Teams for some meetings and interviews. Site preparation. After the pre-survey contact and up to 2 days prior to the survey, the organization should upload to MS Teams all materials that demonstrate standard conformance. Upload a list of all current persons served and at least 5 former persons served using only identifiers that do not contain protected health or personal information. If records of persons served are not identified by numbers agnostic of protected health or personal information, the organization should prepare a list of the names or dates of birth of all current persons served and at least 5 former persons served. This list will be viewed by the survey team during the survey. Do not upload the names or dates of birth to Teams. If organizations do not use electronic records, records can be scanned for screen share or paper records will be viewed via live video. Establish 1 or more rooms at the organization for survey activities. Each room should contain an appropriate device enabled to operate MS Teams. For the orientation and exit conference and pre-exit meeting rooms, if applicable, the organization should consider size, capacity, and the number of invitees to accommodate social distancing consistent with public health authority guidance. For the interview rooms, the organization should provide for privacy and confidentiality. To supplement the survey poster, the organization should effectively communicate to persons served that the upcoming survey will be conducted using live video and audio technology. The organization should also make best efforts to mitigate any anxiety that may be associated with the use of technology during the survey using reasonable measures based on strengths, needs, abilities, and preferences of the person served. Additional site preparation. Uploaded materials that demonstrate standards conformance must include all documentation specified in Appendix A of the applicable standards manual. Must include any other documentation that demonstrates conformance, excluding protected health or personal information. Should include a mock person-served record that minimally shows assessment and treatment plan templates. CARF will delete all uploaded materials following the issuance of an accreditation decision. Site preparation. Records of persons served or other protected health, PHI, or personal information must not be uploaded into MS Teams. Materials that demonstrate standard conformance and include protected health or personal information must be redacted by the organization prior to uploading into MS Teams. The survey. The survey team will conduct the site survey, including the schedule of survey activities, consistent with the process published in the standards manual to the extent possible. Technology will be used to perform all survey activities in a manner consistent with the pre-survey meeting between the organization and the surveyor. As the survey team schedules the organizational tour, orientation and exit conferences, the pre-exit meetings, if requested, observation of services and interviews, the survey key contact should forward each meeting invitation email to the appropriate staff, leadership, person served, or other stakeholders. The organization should also forward meeting invitations to the staff who will facilitate the survey team's review of records of persons served and other written materials. The orientation and exit conferences and interviews will be performed using live video or audio. The organization tour and observation of services will be performed using live video. Review of records of persons served will be performed using screen share or live video. The survey. Review of other written documentation will be performed by surveyors reviewing documents uploaded to MS Teams organization channel. At the end of each survey afternoon, other than the last day, the survey team will communicate to the organization the progress of the survey and the next day's activities using live video or audio. Traditional telephone calls may also be appropriate for some survey activities. After the survey, the customary CARF accreditation processes are involved. Approximately 6 to 8 weeks after the survey, CARF notifies the organization of the accreditation decision and sends the accreditation report, certificate, and quality improvement plan. Within 90 days following notification of accreditation outcome, the organization fulfills an accreditation condition by submitting to CARF a QIP outlining actions that have been taken or will be taken in response to areas for improvement identified in the survey report. The QIP form can be downloaded from Customer Connect. CARF maintains contact with the organization during the tenure of accreditation. Organizations are encouraged to contact CARF as needed to help maintain conformance to the standards and are required to provide timely information to CARF about certain events that occur within or affect the organization or its accredited programs and services. Thank you. If you have any questions, please contact CARF at 888-281-6531 or www.carf.org//contact. If you know the name of your resource specialist, you can save some time by calling them directly.